Right, and then you still got a lot of big.
Well,
it's more like
It is.
or it's almost like a shirt saver kind of thing.
Yeah.
But it's like it goes over your head
So
and then
that way you get it
a snap or something. So it's just it's more like an apron.
One of the nurses had
without
like
my gloves on.
one of those
Like a
half
fanny
aprons.
the edge of it. But
Yeah, it was like a half apron. It had like 6 pockets in the front. She had stuff in there.
Yeah, nice and folded. See, I would think I would want, this is the bottom of it, so it's okay if I touch that. Is that correct or no?
And this is a guess, but I'm thinking you could just dump that
the whole thing.
out and then open up your wrap.
But this isn't sterile.
But it's all,
No,
it's all
but
wrapped inside
but
there.
this is
The
your
bottom
your
is.
wrap, and that's just the that's the mask,
So you don't think
and
that will-
and the glove wrapper.
So it's okay if I just dump this?
I'm saying I don't know what else to do.
Okay. All right, and then just set that aside. And then I would need to.
But now, because this is going to be the underside of
Right,
it,
so
so
I can
go
touch
ahead
it
and touch
still.
it and
Yeah.
and turn it, turn it over here on your.
Figure out.
I'd set it down flat. I'd set it down flat. We're this way, like
Okay.
set it now. Open it up.
Like
See, and
take
this is you're going
that
to open
part?
this towards you.
Oh, wouldn't I take that part out right there?
Maybe. Yeah, I'm sure.
It's new to all of us.
Yeah,
I think
okay.
Okay, there we go.
So I'm wanting
But
to
so
hold on
this
to
you
the edge
want to open
towards
towards
me.
you, and then you've got a mask to put
Which-
on.
Yeah, so this
There-
part, I don't, this,
It's just a
not
mask.
sterile.
Yeah.
Yeah,
Can't
so
keep
that's
it
fine.
sterile.
Okay,
So why don't
so.
put it on, or put it
Yeah.
on the patient.
Well, I was just gonna open my sterile field first. Is that
All
okay?
right, well, now you're breathing on your sterile field.
Yeah.
Why do you wear a mask?
Okay, so put the mask right on.
That's so logical when you say it like that.
You gotta remember, our brains go kaputty when
Yeah.
you're sitting there.
Thank
Yep.
you, thank you, Tammy.
Mine does, I guess.
I think
Oh,
it's
yeah.
nice.
As I sit there, I'm gonna say,
We almost have the same glasses.
I know, I noticed here. And now it's all, oh, okay.
Okay, now
So
what
you
about
wanna
him
get
and your
this
hair?
under your chin probably. There you go.
Okay,
There
and
you go.
give him his
Sure, go ahead and, yeah.
little cap and.
And we'll say
put the
he's got a
on.
mask.
Oh, he's got
yeah,
this
okay,
mask.
so he's got a,
Just put it on.
yeah, you can just set it up there. Now, are you gonna draw blood or are you just
You're
dressing
gonna
change?
do dressing.
Okay, well, I think I'm gonna be giving him a transfusion.
Oh, so you don't probably want me to cover that all up?
Well, no, I
Just
can,
put it
I
on the
can
table
reach in.
and they'll get the.
All right.
you did it.
Okay, and put my own little lovely cap on. Darn it. Thank you. Okay, so now, but I wanna take the, this is fine too.
Yeah.
'cause it's just
That's right.
outside. So now.
Now, think way, way back.
I know.
It's set up right over there.
Yep.
Trying to stay on the little edges. Oh, there's the
I think you
crease.
really wanted this
Hold
edge
that.
probably
Right
next.
there.
Oh, and actually with that maybe, I misled you when I said turn it around, because you're
Yeah.
gonna be better off if you could
Like
pull
this?
that towards you.
Like
Yeah,
that? Is that
yeah,
what I mean?
uh-huh. But as you are doing, be kind of firm about straightening it out.
Yeah.
You're doing it?
Bing bong bang means boomerang.
Oh, man.
Yeah, it comes back to you.
It does, okay.
But remember, only the middle part needs to be sterile. You don't need this
Right.
huge sterile field.
Okay.
And now, what part are we dressing?
Are we?
Okay, well, now I'm gonna ask you a really big question. Why did you get a sterile field here that you're gonna have to reach across to take off that dirty thing?
Clean gloves and take it off first.
I should have
So
done that before I opened.
Or
it.
do this on your bedside table, or, that somehow, but, kind of think through your.
That's your bedside table here.
So just
Is there
fold
one?
it back up and then.
Yeah,
Sarah, this is a real person.
yeah.
I'm just kidding.
Yeah, Nicole's got a good idea. Just
She's bringing a table.
cover it back up.
What if I just move it?
Sure, that works.
Yep.
That works.
Oh, we're gonna move it in there.
She's got all these guards.
Yeah.
I
She's
know.
got all these sterility
Now let's see if
police
we
here.
can move it without making it unsterile. Okay.
As long as you have your right eye on that, you're good.
Oh, how does that work?
I know. You're a mom.
Okay.
No, I'm just kidding. What are you looking for?
Clean
You want
gloves.
to wash your hands, put your non-sterile gloves on.
Yeah, that's good, thank you.
Yeah, and then you're gonna clean the.
Wash my hands?
Yeah.
Oh, they're there. Thank you. I'll put my gloves on. And that just peels right off, I'm assuming. But would you use something to make it not hurt so much when you
And-
peel it
I
off?
use an
Like
alcohol
that.
wipe as I'm peeling it off.
Yeah.
That's what they showed me is alcohol wipe, and
Okay.
it doesn't stick. Kind of just rub it under it as you're going, and it makes it come off.
Yeah, just even for like IV, desing
Is
IV.
this one?
They're
With
both
the-
alcohol.
Yeah.
This is alcohol, but in theory this is what.
Are you gonna put that on
I
Facebook?
didn't see that. they-
This would be a very interesting video. It's really kind of bumpy, and it's not really my fault. It's just because this is a small camera. You know what I mean? So it moves like woo. So you have motion sickness?
I know, I'm so sorry. This is gonna hurt just a little bit. This is hurting me more than it hurts you. They're like, no, I don't think so.
I've heard that if you ask the patient, do they like to have it taken off fast or slow?
That's good.
But you have to be a little bit careful with the line when you, in case.
Oh,
it's
yeah.
stuck.
I mean, we have to be within limits here. Just rip it off.
Okay, now I need
Garbage.
garbage.
Or it would go into a red bio bag, wouldn't it?
Yes, because it has blood.
Yeah.
products.
Okay, we'll pretend this is a biohazard.
Yeah, that's real.
And now we should have got it. There you go. Is there, so the biobags are typically in their rooms? and
Yes.
they are
Yep.
things, right?
And sometimes Central Supply does not restock them, so please make sure you.
Okay, and then I need to,
Or even then you could use your hard wrapper there to
then I would
put
need to
stuff
clean
in.
that.
Okay.
She could.
You know, I'm saying if you didn't have another place
Yeah.
for it, you've got that won't,
Okay, now.
Now.
You wanna do now you wanna remove your gloves and wash your hands
And put on the sterile gloves.
and put your sterile fill back there and, yeah, right guys?
Would you put it back there or would you leave it here?
Just leave it there, yeah.
Not supposed to reach across it.
or that even theoretically now is when you'd open it up.
Yeah.
Yes, that's what we'll do next time.
But it's
I wonder if I can.
But just to, muddy the waters, but now this is open to air
know,
as
that's-
well. So, I mean, you're gonna have to weigh
Hurry.
one thing against another. You might say, I know I am gonna be so slow and plodding about this. That I'm gonna, but then also your sterile field is open to air. So,
Hold your breath the whole time. She's got a mask.
she has her mask on, as does Chester.
Hey Nola,
Mhm.
when you have to clean the line,
Mhm.
do you do that with your clean gloves or sterile gloves?
Well, it's really with your clean gloves, cause sterile is just, the insertion.
Yeah.
So, I mean, I guess it's a matter of when you do it. You can do it when you're sterile, or maybe you would hold it with your, this part, you would sort of stabilize at the site with your sterile glove and cleanse down with your clean glove.
Okay, so in this situation, we're also gonna have one clean and one sterile.
Well, I guess we'll see, or once you do that, it's gonna, that hand's gonna become clean as opposed to sterile. But you really do, unless it's really sutured in, you do wanna hang on to it before, so as you've got this thing on the neck, you're wanting to hold it there when you're
The inside
washing down it.
is not clean. So
Inside.
the inside, so I can touch the inside. I just haven't done this for such a long time.
Dome it in first.
Put the
Put it on
dome.
the dome.
Okay.
Yeah. Hopefully the right size for you.
But, with this, usually you're kind of improvising every time, you're sort
Yeah.
of thinking about, okay, now what do I want to do next? And, and there are some good suggestions, but, just sort of have a plan or at least be mindful with each step. And then you could think, oh, I probably shouldn't have done it that way, but, okay, well, how can I recover? How can I, and there's usually a way you can work around it. And sometimes that's have the patient turn on the call light and have somebody come help you. I need another set of hands. Or, I've been that way. I've been trying to disconnect something and my hands are sterile, I say, you know, will you turn on the call light? And when they come on, I say, you know, I need a RN who can help with a dressing change. You know, and usually they can tell by your tone of voice that whether that's oh by the by or.
Okay, so would it be a good idea to kind of spread everything out? Everything's sterile, and I've got sterile gloves.
You
just
can
to
do
see.
anything within that sterile field you want to.
Okay, things like that, I would like to know, you know, what everything that I have.
And of course, if you, I mean, this is awkward, you would probably be standing up, so it would be a little easier to not have, you wouldn't have to be holding your elbows so much up in the air, so.
Okay.
But so that,
So what
that,
back to the-
you know, transparent dressing
Is nice.
looks fine to
Yeah,
me.
me too.
That looks like a good size.
Okay.
Now
Can
you
someone take my glasses off?
Yeah.
Thanks. They are so
They're
foggy
steaming
now.
up, yeah.
Well, and
Okay.
that can be, if you get the nose piece real tight,
That helps?
and it's because of the moisture coming up in there, so if you get that nice and tight, that will be
Won't
helpful.
come up to the glasses, okay. So, I'm going to clean first.
So I see alcohol swab, what's the other one, is that
This
skin
is-
barrier?
This one is
Yeah, what's that?
povidone iodine swab sticks,
Mhm.
and this one is ointment, povidone iodine
That's
ointment.
Okay, and that would, now, just because it would stain, and I'm gonna say or even policy will be different places. Lots of places don't have you put the ointment on, cause they think it's just a medium for infection.
Yeah.
So probably, so I'm gonna say, so our policy does not have us putting ointment on. Now, it could be if it was open or weeping, you
Okay.
know, perhaps, but
So
we wouldn't put the
mix that.
ointment on. And let's use, and we'll,
Here, I'll switch them.
yeah, let's switch it out. Let's use chlorhexidine as opposed to betadine. Just because chlorhexidine really is superior, betadine is okay. No, don't open it up,
Okay, we're
just
just gonna
switch it out as though
Okay.
it's all,
Okay,
as though
so
this
it's-
kit had
because this one's
chlorhexidine.
stained.
Is this stained?
Is that what you're saying?
Betadine will stain
Ah.
Chester, plus
Oh, okay.
in practice,
This just says alcohol.
that just says alcohol. though.
Oh.
Oh, it
so-
wasn't,
Oh, this
this
one.
one, that's the one, okay.
Oh, we're like,
Yeah.
Okay, so that, let's
So
just
then
put
we'll
that,
just-
let's just put that someplace.
Somewhere nobody will use it.
Well, I mean, it's okay to use it, it's, yeah.
Sorry.
Stop.
Sorry, Sarah.
Here, you don't need it then.
And your field's really
It's
still
still
sterile.
I know, it's really still, yeah.
It's all the crows coming down. looking at it.
Okay, so I'm going to use this
sterile
to clean the area.
You're gonna use, whatever we said was you're gonna
The
use
chlorhexidine.
chlorhexidine to
Yeah, that's the
cleanse
blue
the
one.
That's
area.
Oh, the
chlorhexidine.
blue,
Yeah.
okay, all right. And I'm going to see if I can.
It'll work from the other side too, there's a little slot there.
And once again, the outside's clean, so I can just,
And, but also, just drop it, if you make a mess and have to
Would
clean
you
it up
just-
later, I mean, don't be
Oh.
reaching, you know, you've got your sterile gloves
Yeah.
on, don't be worrying
Okay.
about getting this in
So,
the
I
right
guess
place.
but I can
In-
leave it in, I don't need to
In
dump it
theory,
out.
Sarah,
Yeah.
this is what we're reenacting is that this came in the sterile package.
Exactly,
Yeah,
oh,
so
I got that.
That's
Okay.
what I had
Yeah,
at the time.
I got
because
that.
I
Okay, so I wanna just,
Yeah, so you can touch all around.
right.
Yeah.
And it's okay if I set
Yeah.
it back down? Yeah. Okay, now, with this, would you start on the inside and work out?
But
Is that right?
I think, is it this,
Yeah.
now,
It's
help me
30
from the policy,
seconds
I think
back
that's,
and
is it,
forth.
it's the
This is
same
just-
story back and
Mhm.
forth,
Oh, yeah.
I believe.
And you'd be using
Yeah,
that.
let's,
Is it-
let's-
No, where's that?
well,
other
where's
thing
the, I think Sarah has it
Yeah,
Right
right
there.
there.
Oh, okay. Do you want me to read it?
I
Oops, sorry.
couldn't find it in there.
So,
Oh, okay.
But-
okay, look at
30
the,
seconds back.
I believe
Okay.
it is
Yeah,
the
it says,
same.
yeah.
But like, are you just going
see.
over the, back and forth over
I think it's a
where
2 by
the,
2.
Well, I mean, I would tend to start at the side and work out.
Yeah.
you mean like start at the top?
But
At
you,
the
but
site
remember,
where
you've
the
got
blood
three
is.
swabs,
Okay.
so start at the site and work out, then get
Okay.
yourself another swab and start at the site and work down, maybe.
Yeah, okay. But 30 seconds total for all 3 swabs, or 30 seconds per swab?
30 seconds for all 3 swabs.
Okay, so that's probably good.
And again, I wouldn't,
Do you wanna save
drop
this?
it. No,
Glove
no,
thing.
Okay.
yeah, that's a good place for it.